All right. Harris, this is it Harris S5 or 2.4? Yeah, which one is it?
Can you guys hear? Yeah, I can hear Jason. Yeah. Okay. Danny, you good?
Oh, I'm in.
Yeah, I'm good. I can hear. All right, Nick.
Thanks, Jason.
Okay. All right.
Oh, can you
Yeah.
pull that stuff today out? All right, this is good. Let's see what we got here. Where is?
Not a bad thing to know.
We'll get this going in one sec. Nice. Okay.
It was right off the highway.
Where Vermont, it doesn't matter where the same location.
They can't see us. Can they?
No. It's down there.
It's like I need to
Maybe yeah.
Right now, it's getting through it. I'm wondering how I think.
I'd love to have.
All right. And these guys see this? Is this, should I lower it just? I can,
Yeah.
let me lower it a little. How's that?
Yeah, that's fine.
Nice. Is that good?
Yeah.
Can everybody see out there in?
Can you guys see that screen?
internet
Anyone?
land?
All good.
All right, cool.
Nice. Okay, guys. Hey, it's Dr. Bregman. Hi, everybody. Hope everyone's doing well. This is a quick review on fentanyl and ketamine. And I know that you guys are starting to use these drugs on the ambulance crews, and I know you probably already know a lot about these meds on your own anyway. This is just a formality to do another quick in-service. We had done this one a little over a year ago here, and this is just a similar review. Is the focus good for everybody? Can you see that? All right, anyway, fentanyl is what we'll start with. Fentanyl obviously is an opioid. It's a synthetic opioid, and it can be used in many different medical settings. There's a lot of hype about fentanyl because of its abuse potential and danger on the street, but that's a side thing that we all know about and hear about. But we are going to be using it medically because it's super effective. It's has one of the it's probably the highest potency measured against any other opioid, which is probably why it has such a dangerous component when used incorrectly. It can be administered a number of ways: IM, IV, transdermal, epidural, and even intranasal. Can be absorbed through mucous membranes. For purposes of this review, we're mostly going to look at IV/IM because that's what you guys do. And IV usage is the most reliable and preferred, just because of the level of absorption and reliability of dosing. But IM can be used, but it should be reserved in those patients who you truly can't get an IV in, but it can be used. Mechanism of action, it is an opioid drug which binds to mu receptors in your body, in the brain and in other organs, the respiratory, the cardiac, blood vessels, and brain. But the big thing that we use fentanyl for is because when it binds to mu receptors in the central nervous system, it causes modified pain perception, and it's very intense. It is mainly metabolized by the liver. I'm sorry, it's mainly excreted by the kidneys after being circulated through the liver pretty much unaltered. So it's a renally excreted drug. It has a substrate in the liver called the CYP3A4 system, which is just a chemical pathway that biochemists and biophysiologists have identified. The half-life of fentanyl, approximately 2 to 4 hours, but this is dependent on the total dose and whether it's used as an infusion or in boluses and with other meds. It's very effective, but it has some risks, such as do other opioids, such as morphine, dilaudid, and meperidine, which is Demerol. Hemodynamic effects of fentanyl include reduce in respiratory drive. So it can reduce the respiratory rate and breathing. It can reduce the systolic blood pressure. It can slow the heart rate, and it causes obvious CNS depression. So people on fentanyl can become stuporous or, sedated. It can trigger nausea like other opioids, and it can reduce the gag reflex. So in using fentanyl, like other drugs, you have to be careful that someone could vomit and then aspirate because their gag reflex is blunted. In some people, you can get an allergic response, just like with other opioids, such as morphine. People have opioid allergies. It has synergy with other opioids, which means it is stronger, has a stronger effect when used with other opioids, which, a little aside, is really the toxic effect of illicit use. A lot of people who are marketing these drugs on the street will increase and enhance the effect of other opioids like heroin and other street drugs by cutting it with fentanyl because it's so potent. And this is the synergy effect. But it also has synergy with substances like alcohol and other depressants. So that's something to consider, just like you guys do when you use, morphine or dilaudid or other drugs in the field. The uses are great. The main uses are analgesia, sedation, and anxiolytic. That's where you guys will use this. Someone with a severe injury, a femur fracture, a bad hip fracture, or somebody in the field who's, had a multi-trauma, not only will it give effective analgesia, but it will also cut the anxiety and panic that people are experiencing. Some of the other uses are for anesthesia and RSI, rapid sequence intubation. It's very good for that too. I don't know. I will look through the protocols. I don't know if you guys, does anyone here know if it's part of RSI protocol yet? No. All right, yeah, for our purposes, it's not, and we don't even use it in the ER as such. It's pretty much reserved for the operating room for RSI purposes. But that's just something to understand about it. Severe pain is the main thing that you may use it for, and that's the first thing we'll touch on. Typically outside the hospital, IV or IM, you can start with 25 to 50 mics or 0.35 to 0.5 mics per kg. But have you got, does anyone here know how the ampules come? How they will become?
Oh, sorry.
Yeah, the mics, no, you can
There's
answer.
mics like, a vial of 100.
Yeah, I think it's 100.
Yeah.
2 ml.
Yeah.
Okay, yeah, so it sounds like you guys are gonna get 100 mics. You can, 100 mic, you can load a syringe with 100 mics and give a quarter to a half of that as your first bolus and wait for an effect. That is roughly in the range that you will get for the average size adult, 60 to 70 kilogram adult. This dose can be repeated every 30 to 60 minutes as needed. More frequent dosing may be necessary if based on pain levels and hemodynamic status. As I said earlier, IM route can be used also, but it should be reserved for those unable to establish IV or if IV access has been disconnected or pulled out. It's safe in patients who have renal failure. It's one of the safer opioids in renal impairment. And the reason for this is it's highly lipophilic, which means it distributes in the fat cells very quickly. Like I said, there's very little change for renal dosing. So that's good. You basically keep the same dose. But you have to keep in mind other factors such as size, age, prior opioid history, and other meds. Dosing variation. Okay, based on typical doses, however, individual patients will require higher or lower doses. Okay, that's obvious. So based on a patient's specific factors such as comorbidities, severity of pain, other meds being used, degree of past opioid exposure, and opioid tolerance. For example, look for duragesic patches or pain patches on patients with chronic pain history. These patients may require a higher dose. However, if they have other opioids on board, you may want to remove a patch or just be aware that you could get a synergistic effect. The goal is to titrate to specific treatment goals to reduce pain, improve function. So you can ask patients to give you some feedback or just look for signs of pain relief and while monitoring vital signs. Keep track of BP and respiratory rate and level of consciousness. These are all things you guys already know. RSI will just be real quick, can be used in RSI, need to be careful, usual dose 50 to 200 mics. We won't touch on this too much because it's not going to be in the protocols. And it's here in patients with increased ICP, head injury. You need to use a higher dose, interestingly enough, 3 mics per kg or approximately 200 mics. There are adverse reactions, as I mentioned, cardiovascular, cause bradycardia, it can cause peripheral edema. The respiratory adverse reactions include respiratory depression and even bronchospasm. So be careful when using it in asthmatics, particularly an asthmatic who's in the throes of an attack with maybe another injury going on. It can cause neuromuscular effects, such as back pain and asthenia, which is like a feeling of severe muscle pains and spasm. It can cause gastrointestinal problems, abdominal pain, anorexia. That's not really an issue for you guys to worry about. And also CNS effects, confusion, depression, dizziness, drowsiness, fatigue, headache. People with urinary retention, it can worsen urinary retention, but it also can do the reverse, urinary incontinence, and occasionally cause hematuria. I think that has more to do with the bladder spasm and the effects of like sphincter malfunction. There are contraindications, respiratory depression, respiratory illness, bronchial asthma. I'd be very careful in using it in these patients. Patients with severe GI obstruction. So someone with maybe a severe abdominal pain with a distended belly that you think might be an acute bowel obstruction. It can worsen the bowel obstruction, so be careful using it. And obviously people with hypersensitivity to opioids, that's basically obvious. There is a cross reactivity. People who have a sensitivity to this cetylpyridium chloride, which is an additive in Cepacol, which is like one of those medications people would buy in the pharmacy for severe sore throat or numbing their throat. For some reason, people with those sensitivities also will react to fentanyl similarly. So be careful. It's a rare thing to worry about, but keep in mind. Like I said, precautions include transdermal patches. So look for a transdermal patch on a patient if you're about to use it. Patients who are already on other opioid medication, which is a lot of people around here. These patients may require a higher range of dosing. They may have developed a tolerance to opioids, so you may have to go on the higher end. Also altered kidney function, no dose adjustment necessary, which is very convenient. It's actually a very safe drug when used in the right dosing, which is probably why the New York State protocols are urging to have this medication on board. Children dosing is similar, but the dosing range is more by kg, and it start 0.5 to 1 mics per kg. For RSI, it's higher. Similar precautions and contraindications are the same in children as adults. Take a quick history from the patients and try to get an understanding of what other meds they may be on using. And that's pretty much it for fentanyl. Start using it as you see fit and see the difference between the historic drugs you've been using, and you'll notice that it has a very high potency. It's very predictable, it's very stable, and very effective. Any questions on fentanyl? Yep, you guys know. Ketamine is the other drug we'll be discussing today, and this I am very glad to hear that you guys are now going to have ketamine available. It's a medication that is highly effective, very safe, and has multiple uses and ease of administration. It's been around for many years, and it can be used in a number of ways. Ketamine is not an opioid medication. It's in the category of a general anesthesia medication, as it's pharmacologic category. It's safe, it's efficient, it's versatile. It's a non-opioid and analgesic anesthetic. There are some abuse potentials on the black market, just like with fentanyl, like most of these drugs. People have heard of cat tranquilizer or K-holes. That's ketamine. The indications for usage in the medical field are analgesia, sedation, light, moderate, or deeper sedation, even general anesthesia. In the right dose, some anesthesiologists use it in certain procedures as the prime anesthetic drug. It's used in cancer patients for chronic pain control. It's used in RSI. It's even has off-label use, but we'll be discussing it, and maybe one day in the near future on-label use for use in status asthmaticus, and also off-label use in status epilepticus, and it can break seizures in some cases, and there may be some medical control use in, say, a person in status epilepticus that's not breaking with multiple doses of benzos. Dosing. It has various modes of dosing. IM, IV, oral, sub-Q, intranasal, and even IO. It's used in acute pain. You can use IV, 0.25 to 0.5 milligram per kilogram to a rough maximum bolus of 35 milligrams. These are rough doses. There are some variation in that based on size and tolerance. For IM uses, roughly 4 to 6 mics per kg, and that can be repeated in 10 to 25 minutes using half the dose. So say you give someone an IM dose who has a hip fracture, it's a long transport time. You can repeat the half the dose again in 10 to 25 minutes if they're still in severe pain or they're still very agitated. Intranasal uses, there are forms that can be used. It's the same ketamine, it just has a different delivery system. Something that you guys don't have to worry about at this time. Sub-Q is also an alternative for those patients who, for whatever reason, you're not going to need to give an IM dose to. It's very similar to giving IM dose in terms of dosing. 0.1 to 0.6 milligrams per kg. Sub-Q, it absorbs very fast. And IO use is similar to IV access, and it can be used in the same dosing. If you say have an IO in somebody in the field. For RSI, this is an off-label use. It can be used mostly in the ED. We'll go through this quick. It has a fast onset, minimal hemodynamic suppression, minimal impact on respiratory drive. It does not cause bronchospasm, bronchosecretions, or bronchouria. That's why it has an off-label use for asthma, status epilepticus. Let's move on. So dosing in renal or hepatic impairment. So patients, a lot of your patients have multiple medical issues and comorbidities. What's really nice about ketamine, no adjustment is indicated in patients with renal or hepatic impairment. No adjustment is needed. Pediatric patients, we're reviewing this. Intranasal, oral, and IV. Mostly for our purposes here, it's the IV. 1 to 2 milligram per kg is typically used, and here it's this is saying for induction, but you guys aren't going to be using that for that purposes. It's mostly going to be for severe agitation, for pain control. What other indications do you guys know is it listed in our proposal? I'll look through those. There's even a rectal dosing form, 1.5 to 3 mil per kg. That's for seizures, delirium. Yeah. And that's 250. Yeah. Is that the standard dose or is that the max?
For that's 250.
Yeah. It's
What's
very
the-
safe.
What's the pediatric dose?
Pediatric dose is in a kid 1 to 8 years of age, it's 1.5 to 3 milligram per kilogram. Yeah, so what's nice is, I mean, you ask the mom, what's the kid's weight? She tells you he's 30 pounds, 15 kilos. You could start, you can start at 20, 25, 30 milligrams. Just do 1.5 the kid's weight in milligrams.
It is like ours.
What?
It's and for ours.
Oh, good. Okay. Yeah. So, for RSI, I'm sorry, it's 1 to 2 mil. Sorry, Jason. Yeah, I was looking at the rectal dosing. It's 1 to 2, which makes it very easy. So you do basically the kilogram weight of the kid.
Okay.
And you can double that. You can go up to twice that if say the kid's super agitated or in pain. Look through these dosings and get a hang of them. Just know the ranges. You guys can start using it as needed. You can substitute this in many people who say have severe pain, agitation, anxiety in place of an opioid, and see if you're getting the effect that you want. Have you used it? Not yet. It has a very rapid onset and it's very effective. So some of the adverse reactions we'll talk about. These cardiovascular effects, like any drug, if you're given it in a high enough dose or idiosyncratically, in rare cases, it can cause bradycardia, cardiac arrhythmias, hypertension, increased BP, increased heart rate. So, but these, I can tell you, are fairly rare in the right dose and right use of ketamine. They're safer. It's safer than opioids overall. But one thing it does do, which is very predictable, and you'll see this. Have you experienced this, Hector? Have you seen it yet? Or in adults, it can cause like nightmares. And when they start to come out of it, people are like terrified. And that's because they're hallucinating. Yeah. I've had people tell me like, they're, seeing like devils and shit. Or you'll look, the people working on them, they'll think it's like a monster or a devil. It's very scary. But that's, sometimes like work in our favor.
Yeah.
But for kids, interestingly enough, they tend to they hallucinate too, but it tends to be a more positive experience. We recently used it in a kid who really broke his arm really bad. Dad was there, and he was like laughing and smiling. And when he woke up, he was like 7, 8 years old. He said, I said, what were you laughing about? He said that the minions were like on a pink mountain floating in front of his face. And I was like, wow, that sounds pretty wild. But he was like, huh. And he was like, he was doing one of these things, and the dad was like, and he didn't feel a thing during his arm, but that was interesting to see that. So it doesn't, it's not always a frightening side effect. Sometimes it can be enjoyable, I suppose. Yeah. Yeah, is that it? Sorry. Thought I had some other. think I have yeah, I think that's it for this in service. Any questions on ketamine? I had another piece of a PowerPoint that was a little more extended. Let me see if I can find that. But essentially, it's safe, it's very effective, it's a non-opioid, it's non-addictive. You know, kids use it to hallucinate, but it doesn't have a real dependent quality the way opioids do. And it's very hemodynamically safe. Let me get out of this for a minute and
Would you
see.
be able to email me those slides?
Yeah, I can do that right now. I'll do an attachment.
Thank you.
Yeah. I just want to look. There was more text there. I have my sorry if I was talking so loud here, guys. I was trying to project for these guys out there in La La Land, but I know it gets annoying. So my wife says, you know, I was talking to them.
I talk too loud. It doesn't really have. I don't know.
Oh, you making lettuce wraps? Those are good, sure. I don't. It looks like you have plenty, but
I have plenty.
Where you get it?
I was eating those when I was doing the keto too.
Oh, you did Peter?
Yeah, it's like
It's
it's like if you can do it and not deviate away from it, it's like the fastest way. Yeah. Yes. Yeah, I think we're good, guys. I was looking for a supplement, but I can't seem to find it.
Doc, can you reach out to people that are online if they have any questions?
Yeah, any questions for those of you guys online?
No, I'm good.
All right, guys, if you do, I'm sending this PowerPoint to Tiffany, and she can forward it to everybody, and you guys can look through it. And you can always just ask me questions in the ED. Fentanyl uses. Yeah, I think that was it for ketamine. I had a second little like added stuff, but that was fentanyl, but I added that to our current lecture. So look through your fentanyl ampules and just get familiar with it, and you can start using it. Wow, that's good.
Oh, thank you here.
What kind of chicken is it?
Hey, guys, you guys that are online, just acknowledge if you don't have any questions. If you have no questions, you just say, I got no questions, sign off. And then when you're on your next tour, just come in, see one of the supervisors. We have a sign-in sheet, and then we have your CME form. All right?
Excellent. Thank you, Hector. I have no questions.
No problem, Shaw. All right, I'll talk to you later, Shaw. Danny, you got anything?
Thank you.
Yeah,
Hank.
no questions for me. Thanks, Hector.
All right, Danny.
You are.
Nick, you
This is a
good?
class? Yeah.
I'm good.
I'm good. All right, take it easy.
Can you hear me?
Emmy, you good?
I'm good. Thank you.
All right,
Abel.
you good?
Yeah, I'm good. Thank you. I'll see you.
All right, bro. Hey, Snappy, you good, right, bro? No, yeah, right.
That's good.
Yeah.
We do this, yeah.
Your signature here.
Yeah.
And hit that.
Sure.